My guest today is Alan Dilani. He is founder of the International Academy for Design and Health and a champion of salutogenesis. Welcome, Alan.
Thank you, John. It is my great pleasure to meet you. So many years I am waiting for you, and this is just very nice of you to contact me.
Tell me, Alan, I talked about salutogenesis. Let's start with what is salutogenesis? What's the overview of salutogenesis?
Well, salutogenesis is definition that invented and developed by Alan Antonovsky in 1960s, which means saluto means health and genesis means origin. So that means origin of health and what makes people healthy. And this is contrary of pathogenic, which means patho means sick, genes means origin of sickness. So he was the first one in the world that critically reviewed medical sciences, that too much focuses on the causes of diseases, and he invented the salutogenesis. We must focus on health and well-being.
So what are the elements of salutogenesis? I know it's comprehensibility, meaningfulness, manageable. What does this mean?
Well, Alan Antonovsky's point of departure of salutogenic is how people actively, through their lifestyle, focusing on stress reduction. And for stress reduction, we need to have a sense of coherence that is strong. And sense of coherence, by Alan Antonovsky's definition and his theory that has been implemented worldwide, and many researchers worldwide, they have done this kind of research and apply that and demonstrate that if we have strong sense of coherence, we are ready, we are more capable to manage stress. And he has three dimensions for the for the sense of coherence. Comprehensibility, that means world is understandable. Whatever we do, we should understand what we do. And then manageability, resources to meet the situation. Whatever we do, we must have enough resources to manage the task. And also it must be meaningfulness for us. Life makes sense to fight for our vision, for our goal. So it must be rewarding for our brain. These three dimensions we can measure. Each of us, we have different sense of coherence. That means we have different coping strategy with stress, and we are different in terms of managing stress.
So does coherence also mean the way in which we have a wholeness of life, a fullness of our own lives?
Yes, definitely, definitely. I mean, meaningfulness, whatever give us the meaning, it's kind of rewarding for our brain. We feel good, we feel positive, and this make us still stronger to manage stress and to coping with stress.
And since stress, we also know that stress causes inflammation in our body. So if we reduce stress through this idea of fullness and coherence, we also reduce the inflammation in our body.
Yeah, but it's very interesting to say that stress, the theory of stress, is the point of departure, is physical environment that creates social organization, structure, and function in our society.
So explain that a little bit more. How does physical environment increase or decrease stress in this concept?
Well, the physical environment, through its social organization and structure and function in our society, will lead to psychosocial stimuli. Wherever we go, we got stimuli from the environment, from what we see, we interpret. This psychosocial stimuli, together with psychobiological program in our body, tension, blood pressure, heart rhythm. Together, this tension will develop a mechanism that we call stress, and it developed to precursors of diseases and later to diseases itself. So the physical environment is crucial, how we develop, how we design to reduce the daily stress in our life.
So what are some of the design principles that you would suggest are part of salutogenic design?
Well, if we looking for how to increase our comprehensibility, manageability, and meaningfulness in our daily life, for example, for comprehensibility, we need mainly to have a wayfinding very clear. Colors, nature, perception of the spaces, landmark, pleasure, all these reduce stress and increase our comprehensibility of the environment. And then manageability, how to manage the way that we are working, perceiving the environment. It should be static, elegant, natural light, green environment, restoration, interior design, and ergonomic stimuli. All these give us very pleasure to manage the task, to manage to be there, to sitting and working, whatever. And also meaningfulness should be the positive distraction, the music, the art and pets, gym, social support, comfort, view. All these increase our meaningfulness within the environment. Wherever we live, work and play as a kids. It should contain this design factor that actually increase sense of coherence.
Now, if I listen to what you just said, it's good design. It's positive design. It's good design. There's nature, but you're bringing with it a structure. This concept of comprehensibility and of manageability and of meaningfulness. You bring structure to it, but everything you said sounds just like wonderful design.
Yeah, absolutely. But you can seldom the architect understand this kind of connection. They believe that, they think that, but they don't know how to relate it. And compatibility of design with sense of coherence is important. And this we need, for example, when we design a zoo, we need sociologists, we need zoologists, we need nurses, we need many disciplines to understand how the animals socialize together, how animals eat, how animals play, and how animals sleep. But ironically, I must say that when we design very complex building like hospital, like many other complexity, we don't ask public scientists or psychologists, sociologists, other discipline as architect to understand how interaction between people and the environment could work and compatible with their need, especially for Alzheimer patient. We need many disciplines to understand.
So before we go on, so you're saying there's a process that goes along with this salutogenic design approach.
Yeah, we need mainly more interdisciplinary approach. That is missing. Many architects believe that they can do everything without consulting other disciplines. We need interdisciplinary approach to design, to architecture, in order to design appropriate environment that increase our sense of coherence and reduce our stress. And that is not educate architect for that.
So really what you're saying is that the coherence of the environment, which can be used to reduce stress and have a healthier life, has to be reflected in the coherence of the process.
Absolutely.
So that there's a coherent process that includes all of the different dimensions of science and of art and of design to bring this together.
When we call salutogenic design, we need the sense of coherence of the building that is compatible with people. And unfortunately, because the lack of interdisciplinarity of designer, we never reach this approach. We never find all those design factors that could be compatible with sense of coherence within the design, within the architecture, within the city planning, within the school, within the hospital, factories, whatever.
So really, it's all of these different. It's any environment we're in.
Yes, yes, yes.
So speaking about dementia design, and I know you have some interest and expertise in this. What are some of the directions, the principles, or the approaches that you would say are important to salutogenic dementia design for dementia?
Yeah, you see, now dementia in many countries is now second causes of death actually nowadays after coronary heart diseases. So we must pay attention. We have done many research in this area, and we find it out that people with dementia, they need 3 areas of activity, what we call active life, which really they need to be active during the day, and they need also contemplative life, which means cultural activity, mental stimulation, and then they need vita restorativa, that means to rest, relaxation, and recuperation. These 3 areas is fundamental for, and by design, we must provide them all these facility, environment that elderly with Alzheimer diseases that could have access to active life, contemplative life, and restorative life. And this I call salutogenesis. And I believe strongly that there is natural function loss for any elderly that design could compensate. Design could reduce the effect of this natural, I call natural function loss, actually.
So the 3 elements are being active, going into oneself and being contemplative, and then having a time to restore.
Yes, yes. This is crucial.
That the environment is not only the physical environment, it's also the planned environment, the social environment that has those 3 characteristics. Is that right?
What we call vita activa, vita contemplativa, vita restorativa, which means active life, contemplative life, and restorative life. And this is very important to interpret into design. And we have found that all those elements actually within design that are related to active life, which means physical activity, which means contribution in a productive way of life for them, and they are still important for our society. They can do some work and still is important. And also with a contemplative, a cultural mental stimulation by dancing, by playing a card, by visiting museum, by seeing some film, many activity for contemplative life. And also, most of all, they get mental stimuli, which is most important. And by restorative, they must have place to rest, time for resting, restoration, integrity, and safety within the elderly. Where they go, they can stay during the day and also sleep during the night. Must be provided for them.
It's very useful to have a structure like this, because not only can it be used to generate design, it can also be used to assess and to evaluate design.
Exactly, exactly. And we have done like this, and we evaluated, and we have seen in many elderly, the staff, they consider it's very important to have access to these 3 areas. But unfortunately, it's the lack of these 3 areas, which is really not qualitative. And I must say, Scandinavian, despite our very good social welfare, we have lack of this area. And I must say now, because of the time of Corona, we lost more than 6,000 people, majority elderly. because the area of elderly has been privatized and commercialized. And this is really a scandal for Scandinavian, I must say, because elderly social welfare and education, and healthcare should not be the case for commercialized.
Because when you commercialize, you pick on one of these things instead of this person-centered care, saying we have to have activity, we have to have reflection and contemplative and art, and then you need a place to rest. So it may not be the most financially beneficial way, but it is the most beneficial for the people living there.
Exactly. But this is the truth that these elderly, they founded the countries like Scandinavia, the social welfare. This generation, they paid a lot, and they really now they suffer because the society, they didn't give back what they deserve.
Well, but this is the case in many countries now, where you can take one country, but it's in many countries, the care of elderly and the care of people with dementia has become a business as opposed to a calling and a mission. And so, sometimes it can be seen as warehousing. One of the other people that we interviewed spoke about institutionalization, that if you gets bigger and bigger and bigger, then it becomes an institution and you lose the characteristics of health. But it's really interesting because what you're underlying the salutogenic approach that you promote and that you are a champion of is the belief that we must focus on health and on health promotion, not on disease prevention. Because if we think about disease prevention, we are really focusing on the disease, the illness, the pathology, and no matter what we do, it will be pathology focused.
Exactly.
Is this what brought you to this? You are a champion of salutogenesis and of salutogenic design. What drove you personally to this?
Well, when I went for my postdoc, I went to Medical University Institute of Psychosocial Factor and Health. We developed the theory of health. I was the only architect in the Medical University in Karolinska when I mentioned the health is not only about all this technology, all treatment of disease, but health is highly our psychosocial factor, lifestyle, emotion and experiences that create health.
So when you were young, you were just drawn to this instinctively.
Well, it's really, I studied, I must say, with psychologists. You met him. Christopher Konarski, he was psychologist and psychosomatic. Together we discuss about this and we come to conclusion that design and architecture is highly affect our emotion and experience and our lifestyle. And emotion and experience is central part of health. And health is a process. So health is a process and composed of psychosocial factor, lifestyle, emotion and experience, and only 20% biological factor. But medical science entirely focus on biological factor and treat people instead of improving their health. They looking how to treat diseases, which many people by salutogenic lifestyle, they never get sick actually.
So before you go on, so this is a very personal mission for you. It's not only an intellectual concept.
Absolutely. I find that architecture, first time the architect went to medical university and I discussed that, and first time I bring you actually to Karolinska to discuss about this. I bring you musician like Paul Robertson. You remember very well. Paul Robertson, all you and other people come to discuss the psychosocial factor within the medical university at Karolinska Institute. It was 1998, if you remember. So before our World Congress after our World Congress in Trondheim. So we discussed this at Karolinska Institute, and I find that more and more the psychosocial factor, lifestyle, architecture is related to our health.
Okay, I need to ask you the last question. If you could design a poster that would go on the wall of every operator, developer, doctor, dementia designer, and it would go on the wall and everybody would read it every day, what would it say? What would be the big message that you would like everybody to see who is involved with dementia design every day?
Well, I would say whatever you design, you must design for the improving health and reducing stress of people. And you design for our emotion and experiences. And by emotion and experiences, you must define the design factor that improve our emotion, that improve our experiences, that give our safety, that feeling safety, that transparency and wayfinding, all this color, shape, everything, greenery, nature, sustainability, everything, it must be included in your design in order to improve our health. And the mission of design and health is not being applied worldwide. We have still to work very much with the societies, with the decision maker, that really not what they build, they affect our health, they affect our emotion, they affect our experiences. And by this we can save a lot of money.
So I'm going to, from this larger picture, write the poster that says, everything you must do must be geared towards our health, our stress reduction, and our coherence. I think these are wonderful posters, and hopefully we will get these posters up on every wall in everybody's design, so your message of salutogenesis and health and meaning comes across to everybody. Alan, thank you so much for being part of this effort. And as you know, this interview will be part of the Design, Dignity, Dementia Report of the Alzheimer's Disease International Conference in 2020. So thank you so much.
Thank you, John, for being championing in this field, and we are very proud of you. And I wish you all success.